Welcome to the UHC Colposcopy Clinic. So what is colposcopy? You may be wondering, why am I here? And what is colposcopy? You were referred to the UHC Colposcopy Clinic because your recent pap smear was abnormal. That's the reason why you're here today. With colposcopy, we'll be taking a closer look at your cervix and vagina. So what are we looking for? We are looking for any abnormal areas that have caused your pap smear to be abnormal. How will we do this? Colposcopy starts off like most pelvic exams, using a speculum to see the cervix and vagina, using a colposcope, which I like to call binoculars on wheels. We'll take a closer look at your cervix and vagina. Using different solutions and light, this will help us see any abnormal areas. If we see any abnormal areas, we will take small samples or biopsies to further examine it. To get the biopsies or small samples, a biopsy forceps would be used. Also, to make sure there are no abnormal cells higher in the opening of the cervix, we may perform an endocervical curettage, or more simply, an ECC. To do this, we would use a curette or cider brush. Sounds simple enough? During the procedure, some patients experience spotting and some cramping. But you may be wondering, how worried should I be about my abnormal pap smear? To better answer this, let's take a brief minute to explain what pap smears are. Pap smears are screening tests for cervical cancer. The results of your pap smear can range from normal to ascus to even cancer. Just keep in mind, the more to the right your pap smear result is, the more abnormal your results are. Got it? Okay, let's move on. What about HPV? Human papilloma virus, more commonly known as HPV, is very important. While some patients may have a normal pap smear result, they may be positive for high-risk HPV. Importantly, subtypes 16, 18, and 45. Because there is a higher association of cervical cancer caused by high-risk HPV, we recommend colposcopy. Alright, now that you understand a little bit more about pap smears, you're probably wondering, okay, so what are my results? A resident doctor or staff doctor in our clinic will review your most recent pap smear results with you before the procedure. Now back to colposcopy. You're likely asking, what are the risks? The most common risk of colposcopy include bleeding and infection. However, the risk of not performing colposcopy is not identifying abnormal areas of the cervix that need to be treated and risk of that becoming cancer. Before we get started, you will be asked to sign a consent for the procedure and may be asked to provide a urine sample for a pregnancy test. So let's get started. But one last thing, follow-up is key. Remember, most cervical cancers can be prevented by keeping your recommended follow-up. In most cases, follow-up will be a repeat pap smear with HPV testing in 1 year. However, some patients will need another procedure or larger biopsy to remove the abnormal areas of the cervix. Our clinic team will let you know what follow-up you will need. So remember, keep your recommended follow-up. Get vaccinated against HPV. and make good lifestyle choices, because cervical cancer is preventable.